Hello, my name is Ashley Cobb. Welcome to another episode. Today we have Leonne here, and she is a expert, one of my expert guests. She is a midwife, and she's going to talk about how she's seen her clients' lives change during pregnancy and after pregnancy. And so we're going to talk to her, and then we're going to get some questions, and hopefully show some questions that typically people have about being pregnant. Yeah, right. Leonne, nice to meet you.
Nice to meet you. Thank you for having me on, and thank you for choosing me for this topic.
Thank you. Look, listen, the more the merrier. So, because I've never been pregnant, right? So I don't have any kids. If I've been following me any let the time know, Ashley is not pregnant. Doesn't want to be pregnant on purpose, right? I don't have the kids on purpose, thank the Lord. But I know a lot of people most of my friends, all of them actually, besides like one or two, have kids. Because I'm 40, so most people at my age are to have children. So most of my followers have children. So there's all the different kind of questions that people have that come up before getting pregnant, during getting pregnant, and after getting pregnant. So one, how long have you been a midwife? So tell us about that.
Yes. So I've been a midwife for 4 years. I'm a midwife and reproductive health nurse practitioner. Prior to this, I was in finance. I was in finance for 15 years on Wall Street.
Yes. So you went from being Wall Street to a nurse practitioner. Okay.
Yes.
But why the change?
So 2008, 2009 happened. I was working for Goldman Sachs, and I just realized that I didn't really understand the work that I was doing and the impact that it had. And I also wasn't happy. And so I thought about what it is that I like to do, and I've always been interested in reproductive health. I originally was going to become an OBGYN. And so I just said, I'm going to do that. So I pivoted. At 39, I changed my jobs.
Listen, I saw this quote on Instagram, and it was like, reinvent yourself as many times as you need to be happy. So exactly. I know people who change. I changed careers. I used to be a teacher. I taught middle school for 6 years.
You're probably a fun teacher. You're a fun teacher.
My kids love me. To this, most of my students now are grown now. Like they grown. So my kids are their own. So like they'll come find me. Sometimes they find me on Instagram. And they were like, this like you. Like it's like child.
I wondered that. Yep, I've always wondered that. Even like professors that I date that are online, and I'm like, what do you think about your, like when they're on field and those kind of king apps? And I'm like, what would you do if your students? And they were like, well, then my students know.
On a IG live a couple months ago, talking about something. I'm sure something with HIV. I can't remember what it was talking about. Something sex HIV, I'm sure. And in the comments was a student I used to have, and they was like, This guy that teach that so. I'm like, child.
Oh my goodness.
Hey, go away. Well, yeah, so my old students who are they find me. They should be like 25, 26 now, but they find me, and it's hilarious. Yeah. But yeah, so I reinvented myself. So I totally understand about reinventing yourself. Yes. So with being a midwife, right? So what type of things do you come across typically? What do women have questions about?
Sure. So
as it relates to sex, I guess, or just in general.
So a lot of times when it relates to sex and pregnancy, questions are, is it safe? Is it okay if I have sex while pregnant? And it is. It's safe as long as you don't have like vaginal spotting. In pregnancy, your pregnancy is not threatened in terms of miscarriage. There's certain medical things that indicate what we call pelvic rest. And I want people to also understand that sex is more than intercourse. It's more than penetration. And so there are certain medical conditions that can happen that make intercourse unsafe. And so that is something like placenta previa, and that's when your placenta is covering the cervix or very close to the cervical opening. If you've had vaginal spotting early in pregnancy and you have something called what we call like a threatened abortion or threatened miscarriage, which just means that you've had some spotting. It might be what's called like a subchorionic hemorrhage, which is blood that gets trapped during implantation that then bleeds early in pregnancy. That's why some people don't understand that they're pregnant because they say, I got my period, but sometimes it's just that trap bleeding that happens.
Okay.
Those things might indicate pelvic rest, but otherwise, sex is safe and encouraged during pregnancy if that's something that you and your partner want. Mhm.
So, what are some, I guess, techniques or safe ways to have sex during pregnancy? Because, like, so can you still do all the positions? Or some barely? I
Mhm.
know. I've heard the men say that they are scared to have sex with
Yeah.
someone during pregnancy. They feel like they're going to like touch the baby's head. So yeah. So what? So talk about those things.
Yeah. So I always find that funny when, folks are like, I might touch the baby's head or something. And they're really confident in their size. A lot of times you're not hitting that cervix when that person's not pregnant, or else it usually is very painful if you're hitting the cervix, you're moving the ovaries. Like that's usually when people are like, well, I get this sharp pain. But otherwise, you can do all the positions. Now, as the stomach grows, certain positions may be more difficult. So, but positions, as long as you feel steady, you don't have that risk of falling, the positions are relatively safe. But definitely you will have to make some adjustments as your stomach grows, as your body changes. And so you might only be able to do doggy style. Also, you have a lot more blood flow to that area, so the vagina can be a lot more sensitive. And so certain positions just might not feel as good. Some positions might feel great, but some might not feel as good. So this is a time for experimenting, trying different things until you and your partner find something that works. But doggy style, mission, cowgirl, all of those are
All the,
okay,
all those work.
but they work. But also, as your body changes, you're going to be making adjustments. So, does it work for
Mhm.
you? Because what I can say works for me or somebody else might not work for you,
Right.
depending on your body and how you're feeling and all those
Right.
things.
And then they also have I was gonna say tools, but that's not the right word. Um Furniture? I guess that's the right word. Furniture.
Yes, yes. You
So they
definitely.
so go ahead.
Sorry. So sorry, yes, you definitely have those things like and I'm sorry, I don't know the exact names for them,
Uh-huh.
but like the wedge pillows, the ones that
Yes.
kind of, yes,
Uh-huh.
those definitely help as well with the pregnancy. So I would.
I also
Mhm,
heard those balls, the
mhm,
yoga balls help too.
yes,
I can't, for me, I can't stay stable on those balls. So I'm not sure how that works. But every time I get
exactly.
one in the gym, I'm on the floor.
Exactly. So that's the thing I would caution where I was saying before, you want to do things where you feel you have some sort of stable footing. Because the last thing we want to happen is you're on that yoga ball doing whatever positions that you're doing and it rolls and now you have a fall on your abdomen, on your side or something where you should go to the hospital and get checked out.
So
Yeah.
no yoga balls. Got that.
No yoga balls.
Okay, cool.
The wedge pillow on the bed is great for that.
So I was talking to one of our guests on the show. She was talking about how her sex life changed after having a C-section. For her, she had a botched C-section and it left her in a lot of pain. And she really could not have sex without pain for like 2 years or so. What is your advice to people who maybe in something similar? Maybe they've had pain through a C-section, or maybe they had to get, they had vaginal tearing during birth, so they just still are not completely themselves, but their partner is still wanting to have some type of sex life, right?
Yeah.
So what is your expert advice or you would give someone like that?
Sure. So there's so many things that happen during labor that can make you feel separate, maybe from your body, separate from your vagina, not just the physical birth of birthing somebody through your vagina or being cut with a C-section. The one thing I tell people is patience. We as providers will tell you 4 to 6 weeks, usually with a C-section, it's 6 weeks, but 4 to 6 weeks before you resume sexual activity. But it could take you longer because of maybe things that have happened during birth that kind of cause you to be a little bit kind of treat that area of your body a little bit foreign because you have a lot of cervical exams. Like I remember I had a patient that was just like, 21 people put their fingers up inside of me. I'm tired. Because she was getting her cervix checked constantly during labor. And so for her partner to go close to her vagina, she wasn't having it. And it wasn't her first baby. That's the thing. Each labor is different. Each birth is different. So your response to sexual activity after that may be different. You brought up tears. So yes, if you have kind of lacerations that happen, we want to make sure that those heal. For right now, I'll talk more about the vaginal before getting into the C-section space. But around the vaginal part, you've got the tears that are healing. You also have changes in your hormone that affect vaginal lubrication. So a lot of people are embarrassed for whatever reason to use lubrication because they say, before I was pregnant, I was fine. I had that WAP. Now, I'm waiting for that WAP or I don't have it, but I'm not using lubrication. I definitely encourage people to use lubrication. If you're not using condoms, a great lubricant that we midwives like to talk about is coconut oil. Coconut oil is an excellent lubricant, of course, with no kind of flavors or anything in it. And it's also antimicrobial, so kind of helps knock out any bacterial vaginosis or something that you might have. And then, of course, if you're using condoms, water-based lubricant. For the C-section piece, yes, you definitely want to wait those 6 weeks. You go into your postpartum, you get signed off and get checked off. And you may have pain related to that area from the womb. And I just always tell people, you take your time. It's when you're ready. And also, sex is more than penetration. So we have oral sex that can happen, nipple play, which can be it can be difficult maybe or challenging if you're breastfeeding. Because you may no longer relate to your breasts in a sexual way, or you may have feelings about relating to your breasts in a sexual way. Your partner may not relate to your breasts in a sexual way, or might want to relate to your breasts in a sexual way. So my big thing is communication, talking these things out. Me as a provider, I welcome this conversation with my patients and their partners, and we talk about it before the baby comes in preparation for afterwards, because some people are a little bit thrown. But I also say make it fun. Date, after birth to try to bring back some maybe of those feelings. And I tell partners, whether they are male, female, and me, that they need to exercise patience with their partner.
So the 6-week window, I saw on, there was a discussion going on I think Twitter or Instagram, one of those, about how, I know y'all recommend 6 weeks, but there's women who did not do the 6 weeks because they're like, oh, I'm fine. Like I was fine. I felt fine. Everything was fine. So I started having sex in like 4 weeks or 3 weeks or whatever the week was, but it wasn't 6 weeks. So the 6 weeks recommendation, is that a hard 6 weeks? Could it be you can have sex if you feel like it, if you feel better, or is recommended 6 weeks and it's because of certain things?
So what I tell my patients is you can resume sex when you're ready to resume sex. So that might be 3 weeks after giving birth. And in this, I'm talking about vaginal birth. For C-sections, I would say that is a hard 6 weeks. A 6-week deadline. For vaginal births, it takes in a bunch of different factors. One, you have lacerations. We need those to be fully healed. So yeah, that's going to take the 4 to 6 weeks. And that's going to be the recommendation. But if you feel ready to have sex, it's your body. I'm going to tell you based on the birth, based on what I'm seeing, this is my recommendation. But absolutely, you feel prepared to have sex, you can have sex. Lubrication, again, taking time with lubrication, and then also remembering that you can get pregnant. So that to me is the other thing is birth control. If you're not trying to get pregnant again so quickly after birth, you want to make sure that you have birth control. And also, we recommend 18 months between births to allow your body to heal.
I have a sibling. Me and my sibling are 11 months apart. Clearly, my mother did not listen to that.
Yes.
11 months apart. Somebody was going to, they had no business. Okay. So, question. So I hear this too from women who've had vaginal births. They feel like their vagina is never gonna go back to being normal again. They feel like it's now misshapen or it's stretched out. It feels different. All those things. So, is there truth to that? And then, if your vagina does go back, how long does it usually take for it to go back to whatever normal is?
Okay. So I would say that your vagina is never going to go back to that space of when before you ever had a baby.
Okay.
Just like your body's never going to go back to pre-pregnancy, even if you go back to the same size, everything. It's never going to go back in the sense that it might feel the same. You definitely deal with pelvic floor laxness, I guess, for lack of a better word, I would say. The more children that you do have, that vaginal wall does become more lax. But the vagina is elastic, like it stretches to have the baby and then it goes back. But then the muscles, that musculature can become weakened and it can affect your ability to have orgasm.
Okay.
And it can feel quote unquote more loose, and so in that sense, we recommend pelvic floor therapy. But I would say the way that it's spoken about socially is not true at all.
Okay.
The vagina
Okay.
is very forgiving, for lack of a better word. It's very, very forgiving, and it will go back to being tight, for lack of a better word. But, if you're trying to go back to that pre-pregnancy state, that's not going to
Okay.
happen.
So, what is pelvic floor therapy? What is that?
Sure. So pelvic floor therapy is like your pelvic area has a lot of musculature that holds it holds up your bladder, holds up your uterus, all of that. And when you become pregnant, it helps maintain the weight of your pregnancy. So those muscles really get used a lot. And pelvic floor therapy, what it does is it helps exercise those muscles and bring them the strength back, especially after they've been weakened. And so people will talk about, like, if you pee a little bit, when you laugh, when you cough, when you sneeze, a lot of time that's a weakened pelvic floor, and we would recommend therapy to strengthen that.
True
Mhm,
story. I have
mhm,
one of my grandmother's really good friends. She offered this information to me. I didn't ask. But she has one son. At the time she was in her late 80s, probably. Her son was 60 years old. Okay, so she ain't had a baby in 60 years. And she said, "Child, ever since I had my son, I have to wear the pee because every
mhm.
time I laugh, you know, I pee on myself."
Yeah,
We weren't even talking about babies. Like, I'm not even
yeah,
sure where that I feel the need to share that with me, but she did. She let me know that ever since 60 years, for 60 years, she has been having to wear some type of incontinent type of product
yeah,
because her son messed up her bladder.
yeah,
Yeah.
yeah. Unfortunately, poor lady. Unfortunately, it's not something that I think maybe we as providers ask about,
Mm-hmm.
because we see you at that 6-week visit and then that's it.
Mm-hmm.
And so unless we're asking about it in your yearly annual well exam, it's something that isn't really maybe discussed. People may feel embarrassed by it, and then they don't understand how it may be affecting other parts of their lives. Like I brought up orgasm. Like sometimes you're having a weak orgasm or you don't feel like you are orgasming. It can be your pelvic floor that needs to be strengthened because you need those muscles in order to orgasm.
So I heard this. I don't know how true it is, but I heard if having orgasms can help make you ready for give birth, can help make your baby come. Is that true?
Yeah. Yes. So when we talk about like natural induction, orgasm is one of those things that we suggest. And we'll talk about nipple play. Like if you have a breast pump, using the breast pump to get nipple stimulation. Because what happens when you orgasm, and that's why also if you're breastfeeding and you orgasm, you might spray a little milk, you might have a little milk come out, is because the hormone oxytocin gets released. And
Okay.
so the hormone oxytocin is what also promotes labor, brings on contractions. And so we will recommend people to start having lots of sex after 37 weeks. to go into natural spontaneous labor. And it's because of that hormone, the oxytocin. And again,
So,
you can
but
have the
I say that only works though if you have orgasms. Some people have lots of sex and it doesn't lead to anything. So,
no, but that's I think I was like that's what I was gonna
right.
say, like masturbation, like if you have
Okay.
toys, using
Okay.
toys to masturbate, get the
Okay.
rose out, that sort of thing, oral sex, however
Okay.
it is that you can orgasm.
Okay. Because sometimes I've heard stories of people who have children and been married 20 years and never had an orgasm. So just because you have a spouse doesn't mean they know what they're doing.
Yeah,
Unfortunately. So let's talk about. Let's listen. I'm keep
and
honest.
also I should mention that people during pregnancy, I've had more than one pregnant person come to me who's never squirted, who has squirted during pregnancy sex with themselves a lot of times. And I don't know if I'm like, maybe because they're not feeling sex with their partner. So they went out, they got toys, they got a little bit more exploratory. I don't know. But I've had more than one patient squirt because they'll come to me thinking that their water broke. And so we'll talk about what was going on. And they said, I don't know, I orgasmed and there was water. And it was like, oh, well, you ejaculated.
So if you're someone who's never experienced squirting, get pregnant.
Yeah, get pregnant and try the toy.
Next question. So let's talk about people with C-sections right quick.
Mm-hmm.
So C-section. So if I have a C-section, you said the recommended wait time is 6 weeks.
At least,
and why is that?
Because that wound needs to heal. You need that wound at least externally because it's going to take a lot more time for all that muscle layers to heal internally. But you need those superficial layers to heal. Mm-hmm.
And should someone who has a C-section, is there certain things they should look out for during sex? Can they, once 6 weeks comes, can they go right back into it? Or should they still be taking it slow? Maybe you shouldn't be on top? Or is there something like, what are their
So I haven't read or experienced or heard anecdotally anything about position, like stay away from certain positions. That's not what I've heard. It's kind of whatever's comfortable. But even with a C-section, you're going to have the same challenges around hormones. So you may not experience you may experience vaginal dryness. You might not have the lubrication. So it's going to be the same, taking your time. And if a position that you once did, all of a sudden it feels painful, I would stay away from that one for a while. But I don't know of any position that we're just like, definitely no, do not do. If you were somebody who was into rough sex, I wouldn't start rough sex immediately. I would ease your way back into it, see how you're feeling afterwards. And of course, if you experience your scar reopening or any issues with the scar, you want to seek medical attention.
How often does that happen? The scar reopens?
It can happen, yeah. But I don't have statistics, but it can happen. That the wound opens. And a lot of times it's due to an infection because the infection is preventing the wound from fully healing properly. Yeah, so with the C-section, usually you have a 2-week wound check and then your 6-week postpartum. And by that time, all the bandages, everything should be gone with a normal healing course.
This is not related to sex, right?
Mm-hmm.
But I heard this thing. I was part of this Facebook group, and they were talking about a procedure called a cesarean tuck.
Mm-hmm.
You heard of that?
Yeah, so that's where you get the C-section, and then they do a tummy tuck.
Yes, and I was like, listen, if I'm gonna have a C-section, I want this, okay? Like, I go ahead and tuck me all at the same time. So we can get it wham bam, thucky ma'am, get it done at one time. I gotta come back, right? And that I was wondering, like, do these were white women talking about this, by the way.
Mm-hmm.
So I was like, I want to do Black women know this exists, and like, why are not more people talking about it?
Interesting. It's funny. I think I've only heard about it from Black women, like on social media, who've done it, but more like maybe celebrities. I think more of the celebrity kind. But in my experience, no, that hasn't happened. I'm not a surgeon, but also where I've worked, we don't have like a big plastics, because what I'm imagining is the OB like does the delivery and then the plastic surgeon comes in and based off that does the tuck.
Yeah, so
It's
in the group I was in, they were saying that yeah, so some of them had it by two different people, and
Mhm.
then some people had it by one person who's certified in both.
Wow.
Yeah,
Yeah,
so
that's
it
really
was
lucrative.
it was a rich white woman talking. I was just there reading the comments.
Yeah. Yeah, the only thing I would imagine, like, maybe waiting until your last pregnancy to
Okay,
do that, not doing it with
okay,
each pregnancy. But yeah, pregnancy and I think kind of appearance, cosmetic appearance, it is they're tied. There was a trend, I would say maybe 10 years ago, where people were asking for inductions and for C-sections at 37 weeks or 36 weeks early
okay,
in that third trimester before they get what's called like the weight gain. There's like a bump that can happen where you gain a little bit more weight. And so they
okay.
wanted to deliver prior to that to help limit the amount of weight that they've gained in pregnancy.
That's crazy.
So we don't do that.
We don't recommend that. Okay,
No, we
don't
don't
do
recommend
that.
that.
Don't do that. Okay, so is there anything that I did not discuss that you want to tell people who are women who are pregnant what they should look forward to or things they should know about?
The one thing that we didn't really cover that can impact your feelings about sex, whether or not you want to have sex during pregnancy, after pregnancy, is if you have some sort of sexual trauma history, that could
Mm,
absolutely be triggered or re-triggered in pregnancy and in labor. Because if you imagine the focus of a lot of your energy is in your vaginal or whatever you'd like to call that area,
mm,
and you aren't maybe in control as much, which you're not. I tell people all the time, you are a passenger in birth. Like you cannot control when these contractions are coming. You can't really control when this baby is coming. You're not passive, but you're you're an active participant in it. And so a lot of times that can trigger people's sexual trauma or trigger people around that. And that can impact whether or not, or impact their feelings about sex afterwards. And so if a patient discloses to me that they have had that, sometimes patients don't remember and it will come up in labor. I recommend a book called When Survivors Give Birth, and that's about children of sexual assault who are now pregnant and giving birth and how they may respond to that. So,
okay.
yes, it's on
Yeah.
Amazon.
So thank you, Leonne. So can you please tell us where people can contact you if you have social media? If there's a woman who's pregnant and who wants to reach out and wants to ask you questions, where can
Sure.
they contact you?
Sure. So you can reach me. My handle which is down here, otherwise CNM. And that's across all social media platforms except for Facebook, which I imagine this audience is not really. And yeah, so I'll just say I can't give medical advice, of course, because I'm not your medical provider, but I'm happy to talk to you and maybe give direction as to what you should be talking to your provider about.
Okay, thank you. Thank you for being a part of Sex Actor.
Thank you.